the fall, how it ends. It's the fall, how it ends. Or it's the fall, how we rise again. Ooh.
Greetings to all. Welcome to another session of PhysioTV. Today we have with us one of our dynamic alumni, Dr. Disha Patni. She pursued her master's in neurophysiotherapy from Sancheti Institute for Orthopaedic and Rehabilitation, College of Physiotherapy, Pune, and her graduation from V.K. Patil College of Physiotherapy, Ahmednagar. Hailing from a small town in northern Maharashtra, she decided to go back to her hometown after her post-graduation and start her practice there. She is a consultant physiotherapist associated with numerous hospitals in Dhule. She is working as a head physiotherapist in Archana Neurocare Hospital and is also a certified aquatic therapist. She has also worked in Bombay Hospital in Mumbai as a junior physiotherapist. Today, she will be enlightening us with a brief conversation about how she started her practice in Dhule, the challenges that she faced, and how she overcome them. We welcome you, Dr. Disha.
Thank you so much, ma'am. I'm happy to be here.
Same are we. So let's start the conversation.
Yes, ma'am.
Okay. So, as we all know, we are going to just have a brief conversation about how Disha started with her practice in a semi-rural setup, and what are the challenges that she faced there. So, to begin with, uh, I just would like you to give us a brief idea about what is the level of awareness about physiotherapy in a setup like Dhule or a place like Dhule.
Yes. So, ma'am, it's been a year since I'm practicing in today. So, because of my work, I meet a lot of variety of people, like medical professionals, non-medicals, people who are educated, illiterate ones. And whenever I meet these people, I ask them one question for sure: that what do you know about physiotherapy, and what is your general idea about physiotherapy? So depending upon the question, I've received variety of answers. So for them, physiotherapy first is they say that it includes massages, or it is some kind of point therapy. Second, some people said that they use modalities or machines in order to reduce your pain. And lastly, they give some exercises. It includes some exercises which helps in improving your strength. So the matter of fact, people give me these answers or such, I receive such replies because they might have received such services, such wrong services in their past, because here unethical practice is at the higher side. People who are non-professionals, people who are not certified to give physiotherapy services do practice here as a physiotherapist, and people might have come across to their services, and that is why they have this wrong idea in them about physiotherapy. But on the other hand, people who are working closely with medical professionals, people who have access to physiotherapy services in the hospital setup or in the clinical setup. So such people and their relatives do have a very good idea about and awareness about physiotherapy and what comes under it. Like what all different techniques, different treatments are there in physiotherapy in different conditions. So if I have to put it together, people do have like knowledge and they do know the term physiotherapy as such. But then if you'll ask what do they know under that, so that is a little questionable. So I would say people here are moderately aware about physiotherapy in general.
Okay. So if I guess if the patients are moderately aware about the physiotherapy, then what about the specialization in physiotherapy? So are they, as you have perceived your masters in neuro and you practice more of neuro, so I mean, are they that much aware with other specialization or subspecialization in physiotherapy?
So initially when I started working here as a neurophysiotherapist, I got my references through Pune Physiotherapy Group via WhatsApp group and other from neurophysicians from Dhule itself. So when in terms of that, when I met such neurologically challenged people, for example, stroke, Parkinson's, CP, GBS, I asked them about this thing that what do you know about neuro rehabilitation? Like, are you aware of it, or you have just called me because you have given you have this reference for neurophysiotherapy? So the answer which I got was people who are from Dhule and they have got reference from Dhule. So those people were like they were not aware of neuro rehabilitation at all. But some people they took medicinal advice or they take their treatment other than Dhule from higher cities, from bigger cities. So people who come from Pune or Mumbai, so they have a good idea about what neuro rehabilitation is because they have taken it there. And then after later on, they have come back to their city.
So I think still we have a lot of need to create awareness first of for physiotherapy and the specialization that physiotherapy has.
Yes, true.
Yes.
So I would like to say that the level of awareness is very limited. The factors which are actually responsible for this are firstly, there are lack of physiotherapists in the city. So in this area, Dhule is a populated city of around like 20-25 lakh people. And physiotherapists whom I know who are registered physiotherapists and working as a professional are 20-25. So if you do the math, it is obviously there would be like a limitation to neuro rehabilitation in that area. Again, people, if here some hospitals and clinic do provide neuro rehabilitation service or physiotherapy services, but because of lack of infrastructure, um, there is lack of availability of equipments, or if, for example, if you need few modalities, so if there is non-availability of that, so hence because of that, because of such factors, again it is limited the level of awareness.
And what about the medical practitioners? Do they have awareness about or they are aware with different specialities of physiotherapy?
Ma'am, if we'll talk about perspective and awareness of different specialities in physiotherapy, so it may vary widely among the people depending upon their personal experiences, or depending upon the access to the healthcare and cultural beliefs. So here, like I said, awareness of neuro rehabilitation is at a lesser side, at a lower side as compared to musculoskeletal physiotherapy here in rural area or in district area. Whereas if we'll compare pediatric rehabilitation or pediatric therapy, it is again much more at the lower side. People are not aware of that so much. Again, if we'll see if some population have some medical background, like some CP population have their medical background, if their parents are doctors, so they do seek help for, they do seek for pediatric physiotherapist. But then people with a general background, they are not well aware of that. And if we'll talk about women's health, geriatric population, so people are like not at all aware of it. So yeah, but yeah, when it comes to general population, this is the scenario. But when you talk about medical professionals, so here I have seen one thing, that because of my work, like initially I met a lot of medical professionals for networking, for connecting people. So there I learned this thing, or I have observed this thing, that medical professionals who are under 50 years of their age, they were well aware of physiotherapy, neuro rehabilitation, pediatric physiotherapy, and so on. But people who are 50 plus, who are experienced one, so those people were not aware of specialization and neuro. They were aware of physiotherapy in general, but they were not aware of neuro rehabilitation, or there are different specialities in general. So on that note, I would like to share one testimonial from my patient.
माझं नाव जयेश पटेल. माझं वय 45 इयर्स. मी धुळ्याला राहतो. मला एका वर्षापूर्वी पॅरालिसिसचा स्ट्रोक आला होता. त्याच्यामुळे माझा उजवीकडची बाजू पूर्णपणे कामातून गेली होती. सुरुवातीला मी फिजिओथेरपी घेतली. सुरुवातीचे 4 महिने मी रेग्युलर फिजिओथेरपी घेत होतो, कारण मला कल्पना नव्हती की माझ्यासारख्या पेशंटला न्यूरो फिजिओथेरपीची गरज असते. हे मला जेव्हा ज्ञात झालं, आणि त्यावेळी आपल्या धुळ्यालाही नवीन डॉक्टर आले होते फिजिओथेरपीचे, डॉक्टर दिशा पाटणी यांच्याकडे मी मागील 7 महिन्यापासून फिजिओथेरपी सेशन घेत आहे. त्यांच्या सेशन्समुळे मला लक्षात खूप आलं की रेग्युलर फिजिओथेरपीच्या एक्सरसाइजेस आणि याच्या एक्सरसाइजमध्ये खूप जमीन आसमानचा अंतर असतो. आणि या न्यूरो एक्सरसाइज घेतल्यानंतर मला आज मी स्वतः माझी मॅन्युअल गाडी नसतानाही रेग्युलर कार चालवू शकत आहे, ते या पद्धतीच्या एक्सरसाइजमुळे आणि कॉन्फिडन्स आल्यामुळे. आणि आज माझ्या ओळखीच्या लोकांकडे जेवढे लोक माझ्याकडे विचारपूस करतात, मी त्यांना पॅरालिसिस पेशंटसाठी न्यूरो फिजिओथेरपी घेणे का गरजेचं आहे हे समजून सांगत आहे सगळ्यांना, आणि गरजेचं आहे. आणि दोघांमध्येही फरक आहे. रेग्युलर फिजिओथेरपी जे नीडफुल आहे तिथं ती नीडफुल आहे, आणि न्यूरो फिजिओथेरपी जिथं नीडफुल आहे ते आहे.
So this is the written testimonial from my patient. Again, she's a medical professional. Yes, and she's been suffering from Parkinson's, and since a year I've been treating her. But she took her treatment. She took her treatment in Nasik city. Nasik is like a bigger city from Dhule. And in fact, there nobody mentioned her about neurophysiotherapy and how it will help her in her condition. So that was the case, and now she's doing perfectly okay, even in her medical practice as well as in her daily routine.
Oh, great. So considering the level of awareness that we were speaking about, did you face, any difficulties, any challenges, or was it a very smooth road for you to set your practice in Dhule? Especially specialized neuro practice in Dhule, I would say.
Yes, ma'am, I faced like quite a different challenges here, and I did not expect that people might think in this way. So first thing, like whenever I used to meet a patient or meet their relatives, the first thing I have to do was I had to spread awareness about neuro rehabilitation, what neuro physiotherapy is, what do I do, and how will I play an important role in their recovery phase and their healthcare. So that was the first and foremost thing I had to do, and till now I'm doing the same. But whenever I meet them, I first the thing which we learned in our graduation, post graduation, that patient's education is must. So yeah, I had to do that very briefly. That I have to explain what neurophysiotherapy is and how it will help you in your condition, in your recovery. Second, I faced is limited resources. Uh, Limited resources with lack of infrastructure. Here in the hospital setup, if you like, here I go on call in different hospitals for acute rehabilitation, for acute injury to treat. So if you want to make a patient stand or something like that, you need a tilt table, but again wheelchair, tilt table. So there are lack of equipments in the hospital. So there I had to do little tips and tricks. I make sure that the staff I stay friendly with the staff so that they will help me out with my treatment. I take their help to make the patient stand and everything. When you don't have facility, you have to do those things. And
Yeah. Any which way, we Indians are famous for the jugaad thing.
yes, true that. Yeah. So I faced that. The other thing I faced here was I do go for home visits. So, like for home visits, sometimes patients are affordable. They afford equipments which you need for the rehabilitation, but sometimes they are not. So you cannot provide for each patient at the same time. So yeah, you have to use different things around in the surrounding, and you have to be creative with their rehabilitation so that you don't lag there because of limited resources. So that's the thing. And one weird question, not weird though, but yeah, people do ask me that being a female, how do how will I manage a hefty patient or a male patient, a neuro patient? Because again, neuro patients are like they're paralyzed and they are more heavier. So how will you manage it? So they firstly question, looking at me, they firstly question me this only, ki, how will you do that? So yeah, uh, on this point, I would like to give a little message to all the female physiotherapists out there, especially if you are doing neuro. Take care of your health first. Like if you have any back pain, knee pain, first go and treat yourself. Improve your strength, because this will be this will need you for in a long run.
Yeah.
So basically, prioritize your health first.
Yeah, very
Yeah.
well said. I would say, as always, it is said, the action speaks more than the word, and the same must be the case with you. Moving ahead, we would like to go with, I mean, what additional skills that you think are required to be a successful neurophysiotherapist to work in a setup like Dhule?
So ma'am, talking about skills, first and foremost thing you have to have is good communication skills. Like you really have to be good. The way you show yourself, the way you talk, it should be very impressive, and the patient, you should you should convince the patient about your profession, how you'll help him or the patient. Building a rapport with your patient is very much important because it builds trust. Because in neuro rehabilitation, as you know, that it is not a 1 day 2 day job. You have to stay with the patient like for months, maybe for years. So you have to create that safe environment, and you have to make them understand what your job is in their condition. So yeah, for that you have to have very good communication skills. That's the first thing I learned here. Second is you should have a comprehensive assessment skills. Like in our during our graduation, post graduation days, we used to have like 40-45 minutes to assess the patient. But when you have your own clinical setup, when you go in the hospital to treat a patient, doctors are on the rounds, nurses and everyone, they keep coming. You don't have that amount of time. Again, you have to, like in such setup, first, so you have to make sure that you explain your role. तो time उसमें चले जाता है, and then थोड़े part में you have to do the assessment which is required. So yeah, you have to have like your assessment should be to the point, and you have to show your skills to the relatives and the patient so that you know so that people believe in you, that you have like people should know what neurophysiotherapy is, or people should understand what she's doing. So yeah, so that's the second thing I would say.
Yeah.
Yeah.
You can continue.
Yeah. And third is, I would say, treatment expertise. Your treatment should be different from other physiotherapists. Like if you're giving neuro rehabilitation, it should be very playful, creative. You should engage the patient in your session, because the session lasts for hour and it goes on every day. So you cannot treat the patient the same exercises daily. You have to be creative in that. Also, do things like that will make you that will stand you out. Like do some workshops that will help you. Like for example, I've done aquatic therapy course. So for example, you have to do such courses so that you're set so that you can be more skillful during your treatment.
Yeah.
The other thing is adaptability. So adaptability matters a lot in such setup, because you have to be prepared to get adapted to the environment, because you have limited resources. So you have to be creative. You have to utilize whatever is there in your surrounding and in your patient's surrounding. Also, you cannot lack in the treatment part. With limited resources, you have to have good quality of treatment, good quality of patient care too. So adaptation is one thing that is very important in such setup, that you cannot look for every time. आप नहीं जाओगे बोसो बॉल ढूंढने के लिए कि मुझे बोसो बॉल चाहिए. आप use a pillow, use anything around your surroundings so that you can have that effective treatment plan for the patient. Yeah. Other is I would say team collaboration. I've learned that a lot here, that it is very important. In our post-graduation days, we used to, have communication with our teachers and with our seniors or with our batchmates. But in the clinical setup, you have to, like, if you want to create a good network, you have to be in contact with your medical professionals, with other doctors, other medical team members for your networking. Also, go for the workshops, camps with them, so that your skills get much better, and there would be like awareness about the same neuro rehabilitation and neurophysiotherapy as such. The last word I would like to mention is legal and ethical practice. So like I mentioned before, that here the population is higher, whereas number of physiotherapists are much lesser. So so physiotherapists here are helpless because it's like one-man army. You have to, because of lack of manpower, you have to work alone, and people do get help of a helper. They do appoint a helper, and what these people do is they start their own practice. So such practices creates unethical practices in future. So if you if you want to have a setup or in a rural area or in semi-urban cities, so first thing you have to make sure that whatever helper you're getting along with you during the treatment process, make sure that you make them understand what is their work and what is your work. And yeah, you should create a line between that. You cannot send your helper to home visits and make them do your work. You cannot do that. So again, yeah, you have to have legal and ethical practice in such setup so that people will get good quality of treatment. Yes.
Yeah. So considering this, I would really like to say every physiotherapist watching this, that please do register yourself for OTPT council, get your council registration done. And a message to the patients that while choosing a physiotherapist or a specialized physiotherapist, see to it that the therapist is registered with the council. That would be of a great help to our profession as well as for the patient care. Well said by that, or a good highlight point, I would say, Disha. As you mentioned something about comprehensive assessment during the last question, and something about rapport building and everything. So do you think that there is a gap between learning in the classroom and learning through your own practice or in the clinical field when you go out in the field and work? And if yes, if you feel there is a gap, then what are your suggestions or things that you would like to express so that the gap can be filled up?
Before answering that question, ma'am, I would like to say that I really miss my post-graduation days a lot because during those days, no, 9 to 5, हमें पता होता था हमें क्या करना है. But here you have to manage all the things. You have to manage your family. You have to manage your clinical setup. You have to manage patients, their calls, their messages, everything. So yeah, when I started my practice here, first thing I missed was my days in Pune with you all guys.
I think
Yeah,
when you were in your post-graduation or graduation, it's a safe environment. I
yeah,
mean,
right.
there are not other responsibilities
Other
except for studies and some clinical work.
Yes.
But here the whole world is now there
Now
that you have to handle.
right. So coming to that, ma'am, in the classroom or in OPD setup, I've always been there in a structured learning environment where there was a fixed curriculum, there was a fixed schedule that you have to follow this. You had your patients, you had your study time, everything. But here in your clinical setup or when you practice your own, there this thing comes like autonomy, where you have to take all your clinical decisions. You have to handle your treatment plans with the patients. You have to keep your own records of the patients and everything. So that difference is there. Then again, in our OPD setup and or else in the classroom, we have learned about variety of patients, the different cases. In rural area or in semi-urban cities, what happens is word of mouth. Like if you treat a stroke patient, that stroke patient will, contact to other stroke patient, and limited or restricted amount of restricted number of population will come to you. Like you might, for initial days, you might treat only neuro patients, or you might treat only musculoskeletal patients, despite of being a neuro specialist. So yeah, that thing is that there we have, because we used to work or have rotational posting in different setups or in different hospitals. Here the area is quite limited. So yeah, sometimes you might treat the same type of conditions more often. The other thing is supervised learning. In our OPD setup or when I was there, there were teachers, there were seniors, there were our batchmates used to, tell us what to do, what not to do. हम पूछते थे कि मैम ये नहीं आया तो क्या कर सकते हैं, ऐसे नहीं हुआ तो क्या कर सकते हैं. But if you see in your clinical setup, आप खुद के मालिक हो. Like you have to do what you think. You have to go back and read those books. You have to go and visit those videos and everything. So yeah, that difference is there. But again, in your clinical setup, you can seek help from your seniors, but then some restriction is still there as compared to your OPD or classroom setup. Other thing is access to resources again. We used to have everything around us. जो चाहिए था वो मिलता था. But here you have to, थोड़ा सा जुगाड़ करके you have to make sure that that patient get good quality of treatment with limited resources. Yeah. Later on, you may get things you required, but initial days are little tricky. They are little struggling because you have to manage everything along with it, along with the treatment and clinical setup and everything. So yeah, initially you have to make like whatever is there around you, you have to make most use of it. Other thing is limited administration responsibilities in our post-graduation OPD setup, that there was no much admin work I think we had. But here you have to manage your patient records. You have to, accountability comes into the picture here, that you have to see that you create a safe environment for you and your patient. You keep all the records, all the videos of the patient, so that if you want to make sure their progression, you have things in your hand, you have documentation and everything. So yeah, again, you have to build your reputation also, that you cannot, um, do any mistake and that will be covered up by someone else. Someone higher than us will manage, say this won't happen here. You have to manage everything. So yeah, that thing is that there's a huge difference between in OPD or like in classroom setup as compared to you when you have your own clinical setup.
Great. So to conclude with, what would you say is the take-home message for the people or for the clinicians who intend to set up their practice in a semi-urban area? So in brief, what would be the takeaway points that they should definitely remember?
So ma'am, here, as I said that physiotherapists are less in number, so you might get a good business if you think in that perspective. But the thing is, most of us are females as a physiotherapist, and they might move to a bigger city, to a better city. But if you like consider that point, you should like come to rural area, because you will get a very amazing experience here when it comes to patient handling, um, and treating patients, talking to medical professionals. So yeah, like like I want more people to practice in such setup. That's the first thing I would like to suggest. Second is ethical practice is most important thing, that to remove that misconception about physiotherapy from people's head, it is very important to deliver a very strong message, and that will only happen when people start practicing legally and ethically. So that's the other thing. And if you do practice, like there must be physiotherapists like outside, they must be practicing in other smaller cities around Dhule. So I would like to suggest them that don't send your helpers out for home visits. Don't do that. Uh, Third thing I would like to mention is, mm, initially you will struggle to make connections and to create your own network, but later on it will happen. So don't lose hope. And the myth about that practicing in like rural area or in district area is like it's not that happening. But trust me, business wise, patient handling wise, uh, connecting with people at different level, all these things matters a lot, and you will actually create a good if you have good communication skills, you will create network in the city itself and also around the city. So yeah, that's the thing. Yeah.
So I hope the people who are watching or who will be watching your interview would definitely will get inspired, or at least have some idea to begin with if they want to set up their practice in a district or a semi-urban or rural areas. And as it is said that health should be accessible to everyone, hoping that the therapists will also work in the setups, and one day in India, even the ruralist person will have a access to therapy or rehab, I would say that way. And thank you, Disha from PhysioTV team, for sparing time and just sharing your experience, your journey, and challenges that you faced to set up your practice in a semi-urban or a district level setup. Thank you.
Thank you so much, ma'am.